Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes. Today, we are going to discuss one of the writing sessions. And this writing, I am generally discussing to tell you how the writing of OET is all about. This question paper has been created by PASS OET, and we are really thankful to the institute who created this question paper by the name of PASS OET. But again, when it comes to Dr. BKM, we assure you for the best of the best guidance to resolve these question papers and to make it very comfortable for you. As I have always been talking to you all that OET writing is all about managing the data. So if you can see this thing, you will get almost like one page, then you have got the second page, then you have got the third one. So if I present it in the order first, second, third. So if I write all the words of this letter, then I would be able to write at least 250 words or maybe sometimes 300. That is where we all need guidance to understand what OET is. So today I have picked up this letter to let you know what OET writing is all about. So please focus, subscribe our channel if you have not until now, and call us on 76967 34256 for the best of the best OET coaching. And now I'm just going to start this letter. First of all, I'm just going to start from the basics. The people who are listening to my videos for the first time, please subscribe our channel and please listen to this video. You will be able to understand everything about writing. First of all, you start the writing from the end. So we have got 3 pages of this letter and the pages are starting from here. So I'm just going to take it. So the page is starting from here. First page where the patient's name is given, age is given, cultural background, social background, diagnosis is given, then social history is given. Then you go on the second page, then it talks about medical history, psychiatric history, talks about medications, nursing management and progress. Nursing management and progress means what happened during hospitalization. Assessment means this also happens in the hospital, but it can happen in the last of the days after providing the nursing management and progress. You tell about now the patient is having this and this thing. And then it is the last page, the discharge plan. This discharge plan is the most important thing in OET letter. So obviously when you have got a letter of around 300 words or 250 words, you just can write only 180 to 200 words. So I'm telling you the most important thing is the discharge plan. Discharge plan means when you are discharging the patient, there is a plan that needs to be followed. So to the person whom we are writing the letter, so in this case, let us study to whom we are writing the letter. You are the charge nurse on the mental health ward where Ming Zhang will be discharged, and you need to write a nursing referral letter to the local community mental health team. So you have to write the letter to the local community mental health team. So now you are writing letter to this community mental health team. So this is the discharge plan that this team needs to follow. So you are writing to the team leader, Ride Community Mental Health Team. So there is a center name as Ride Community Mental Health Team. So you are writing to the team leader. So now you can well understand the purpose. You are writing to the team leader of a community health team, and you will tell the team leader that this is the discharge plan that team leader needs to implement when the patient comes to the community mental health team. So this is the main purpose of the letter. This is the plan that this person team leader has to perform. So you are writing a letter to the team leader to follow this plan, to follow this plan. So you can understand that this is the most important thing and this is what is composed of purpose of the letter. So I'm just going to write the purpose over here and we'll try to make it very simple for you. So I'm just going to pick the pages as well, like I always do, so as to make sure that I can write it nicely and clearly and you would be able to understand. So I'm just going to start from here. So here is my task. So first of all, I would like to teach you the most important thing, how to write the discharge plan. So here is the discharge plan and I will try to write it for you. Here is the discharge plan. So I have to write to the team leader. So I'm writing the discharge plan. Discharge plan is the last paragraph that you write. First paragraph is also the same, that is also purpose. Fourth paragraph is also the purpose, but fourth paragraph you have to write everything. So today I'm going to start the letter in a different way. So for the case management via community mental health team, ideally assign the patient to Chinese speaking clinician or use interpreter services. So I'm writing to the team leader. The first point I am trying to tell to the team leader is that this patient needs Chinese speaking clinician. So I'm telling the team leader at the community mental health team that you should assign a clinician who is Chinese speaking or interpreter services. Second thing, I'm telling the team leader that you should continue the CBT. Third thing I am telling the team leader is to observe response to any adverse reaction and monitor for the side effects of the reaction. So I'm telling the team leader, we have given the medication, you need to monitor for the side effects. You have to observe the patient response that he does not have any adverse reaction. Encourage physical exercise and job hunting. This is also I'm saying avoid prescribing benzo medication as the patient uses these medications for deliberate self poisoning. So these are the 1, 2, 3, 4, 5 points I have to cover. So I'm just going to make OET very simple for you, and I'm going to start from the last paragraph that you have to make in the OET. So please be little patient. After this, you would all be knowing how to write OET letters. So this is a kind of a discharge plan letter where you are discharging the patient. So the first line you write in the last paragraph, which is the most important paragraph in the discharge plan letter, we tell it would be greatly appreciated if you could, rest of the line same, assign patient to the clinical Chinese speaking clinician or use, if you could assign the patient, same lines. That is why OET writing is the most simple writing of the world. It would be greatly appreciated. So I'm telling to the team leader, I am telling to the team leader that it would be greatly appreciated if you could assign the patient a Chinese, same words, speaking clinician or can provide interpreter services. So I'm telling this thing, interpreter service. So I'm telling the team leader that this is the first thing that you need to do for the patient. So this is the main paragraph, the purpose, and it is the last paragraph I am writing first today to tell you how to select data, because today we have got a letter which is around 300 to 350 words. I have to restrict it to 200 words. So that is why I'm starting from the opposite. In the exam also, you should know the purpose first, then you can select the data. So that is what I'm teaching you at the moment. So first thing is to assign the patient to a Chinese speaking clinician, and this. Second thing, let's see what was the second thing. Continue CBT and observe response to adverse reaction. Further, this is the way you will always write the discharge plan. First line would be, it would be greatly appreciated if you could, then you use the first form from the sentence only. Then further, one passive voice. Passive voice means be plus third form. So I'm making this passive voice. Further, the patient, rest of the line same. Further, the patient should be observed for any adverse reaction. Simple. I have made it very simple. I am telling the team leader that second most important thing for the patient is to observe him. The patient should be observed for any adverse reaction and monitor for side effects. And he should be monitored for any side effects of medication. Obviously, that's of medication, but they have not given what kind of side effects. So I am not writing it. Otherwise, I can write side effects of medications. So please understand how, and it is not taking even 2 minutes. I'm teaching you. That is why I'm taking time. In exam, it will not take even 2 minutes. You would write, it would be greatly appreciated if you could assign the Chinese speaking clinician to this thing, clinician word. The same that is over given. Don't change spellings. Second thing, this. So we are here until now. Now let's see the other things. Continue CBT, encourage patient for physical eyes. The patient needs to be encouraged. So again, a passive voice, but rather than should be, I'm using needs to be. So you can remember these lines, you can memorize these lines to make it simple. So the patient needs to be encouraged. Again, simple. For any, for physical exercise, for physical exercise and job hunting. Done. Then the next thing, avoid prescribing. It is it is important to be noted. So I'm telling again, I'm telling all these things to team leader. It is important to be noted that benzodiazepine medications, whatever the name of the medication is given over there, diazepines should not be prescribed. So I am not writing you word. Please understand, you word should not be that you should avoid, because we are giving the information to team leader, and team leader anyhow cannot decide the medication. Only doctor can decide the medication. So this is a piece of information. So that is why passive voices are so important, that it is important to be noted. It is important to be noted that Pfizer should not be prescribed as the patient uses these medications for deliberate self poisoning. The only point we have missed is continuous CBT. So we will write, it would be greatly appreciated. Further, the patient should be observed for this. It is important. So along with this, CBT should be continued as well. So this is the last second paragraph. This is the last paragraph, which is the most important paragraph. It's done. So I have not done anything. That is why I say OET is the easiest test, because I have just copy paste, and these lines I will always remember. It would be greatly appreciated if you could. The patient should be observed for this. He should be monitored for this. Should be plus third form. Then patient needs to be this. Again, the same thing. It is important to be noted. This line also I will remember. Rest I am copy pasting. I am not doing anything. So these are the instructions for the team leader. Now the most important thing will come. How to save your word count. So now once you are done with this thing, and in the final exam, this thing will be in your mind that these are the points to follow. But I have written it for you so that you can understand. Last paragraph is the easiest one. Now we need to find the purpose of the letter. So I will go to the purpose. For purpose, I need to read everything about the patient. So now I will read everything about the patient. Mr. Zhang Ming is a 30-year-old patient on the mental health ward where you are a charge nurse. Ming Zhang, it's given wrong age 24. Over here it is given 30. So again, there can be some hindrances. That's okay. Whether it is 24 or 30 does not make a difference, but in exam, this will not happen. So even the name is alternatively given. So otherwise you can kind of forget this line. Suppose there is no line like this. So I'm just taking information from here. Ming Zhang, 24-year-old from China, speaks basic English, needs interpreter. Now this is the line. That is why in the last paragraph in the discharge plan, it was given that he needs Chinese speaking clinician. That is why it was given that he needs Chinese speaking clinician, because he is basically from China, speaks very less English and needs interpreter. So that is where I can improve my letter and I can save my word count. So that is what data selection is all about. That I will write everything according to what my data says. So the first paragraph is of purpose that we will write later on. Second paragraph is of social history. So I'm writing the social history, Mr. Mang. So that is important. So I am selecting data according to this. Over here, it is given Chinese speaking clinician. That's why I'm writing Mr. is basically from China and speaks only basic English. And and speaks only basic English and speaks very less English and speaks very less speaks less English. That's it. That's it. So that is what I am including in the second paragraph, that is social history. Then I will read the information. Admission 5th date in Macquarie Rosella ward. So he was admitted to on 5th. Today is 26th. Overall the patient has stayed with us for 21 days. 21 days. Social background, came to Australia as a laborer 5 years ago. So we are in Australia. He came to Australia as a laborer. Permanent resident now. Wife had affair and divorced patient 1 year ago. So now, when we were here, we could observe that he is having some psychological problems. We could observe that he had some psychological problems. That's why he was admitted to mental health ward. So where are we? We are a nurse of the mental health ward. So that is why the patient was in mental health ward. So if you can understand the data selection, he came to Australia as a laborer, not important. Permanent resident now, not important, because community mental health team wants to work on mental criteria, on psychological criteria. So this is important. Wife had affair, divorced patient 1 year ago, depressed and unemployed since. So since the last year, his wife had an affair, she divorced him, and that is why he is depressed and unemployed. So this is very important. Now you will ask me, is unemployed important? Yes, it is important, because in the discharge plan, job hunting word is given. So that is why he is depressed, because he is not working. So this is the second thing I would like to add. He got divorced. So when it comes to medical things, you don't want to talk that whether his wife had an affair or not. It will not make a difference according to the mental. So you simply say he got divorced. So you write to the point. He got divorced 1 year ago, and then you make a wonderful grammatical sentence that he got divorced 1 year ago, and since then he has been depressed. So you use has been word with since. He has been depressed and unemployed. Now, this is a wonderful sentence that will tell the examiner that you are very good at English. So, since, with the usage of since, you use he has been depressed and unemployed. So, he got divorced 1 year ago. So, that is how, if you will understand, I am saving my data, I am saving my words, because I am mixing it up. So, until now, I have said this thing, China. He's basically from China. Then I said his wife had an affair. Lives in house with NSCB, mother out from China, so mother is not here. Mother does not like patient taking psychic drugs due to her Chinese medicines belief. If I go to the last paragraph, which I have already written, so there is a side effect of medication, but there is no point that is talking about mother. So again, I can save this data. I can avoid this data, because there is no point that is talking about mother in the discharge plan. So I will not write this thing. That is the main thing you need to learn when it comes to OET. Patient hobbies are fishing and online trading. Again, not important. So I have saved all this data, because I know it's not important. The only thing I can get confused about is mother. But again, if I go to my discharge plan, that does not talk about mother. That is why I wrote this thing first, to tell you how important is this thing to consider the rest of the data. So there is no point that talks about mother. So I'm not writing here anything about. Otherwise, if one point says that his mother should be educated as well, if any point like that was given in the purpose, or means would have been given over here, in the purpose, in the last one, if purpose mentioned anything about that mother should be educated regarding the importance of psychic medications, if any point like this would have been given here, then this social history would have included mother. So that is the best thing that you can learn, how to save the data. This is, you will understand everything about OET, that this is the whole data selection goes neither according to the patient, nor according to what is important. In OET, important thing is to whom you are writing the letter and what is the discharge plan. What is the purpose of the letter? So the purpose is Chinese speaking clean because he is basically from China. Then the purpose is to have to monitor for the side effects. Third is job hunting and physical exercise. So I told that he has been depressed and unemployed. And then there was about, it is important to be noted that till now there is no data like this. So this is my letter. I have saved lot of word count until now. I have completed my this page. I have completed my first page. Now I have just the middle page to write all of my data. So now let's come to the medical background of the patient. Let's see what important things are in the. If I will write the mother thing, the word count will always reach to 220 to 30, and that is what will cause you panic. That is what will cause you anxiety. So if you can drop this thing down, if you can drop your anxiety down and can understand that it is according to the discharge plan, that you will select the data, you will never have problem. Nil history of depression pre-divorce. That means prior to the divorce happened 1 year ago. So prior to divorce, there was no history of depression. Presented 1 year ago with first episode of deliberate self-poisoning and major depression. So the patient history says that he presented 1 year ago with deliberate self-poisoning and major depression 1 year ago. Attended Chinese psychologist sporadically this year. Current presentation is second deliberate self-poisoning. So now this time the patient is having the diagnosis of major depression and deliberate self-poisoning. So this is the second presentation, means patient had come to us even in the last year. Patient had come to us even the last year with deliberate self-poisoning and major depression. This is his second deliberate self-poisoning and major depression. So this is the current diagnosis of the patient, if you will realize. So here it is. Deliberate and major depression. So this is the second presentation. Now I understand this thing. Medical history of gout, it is not important for community mental health team. Humerus, clavicle, all this is totally unrelated. Medications, mitrazepine 30 mg, Nocte. So these are the things. Let's see. Let me write the rest of the medical history. His past medical history. Now this is how you change from social history to medical history. His past medical history, and there is no problem whether you write social history first or medical history first. There is no problem. His medical history reveals that he had DSP, that is deliberate self-poisoning, 1 year ago and had major depression. But in this case, somehow his medical history reveals, but that is given that he presented the last time. So over here, the best thing is we should not write his past medical history. Normally, I always use this line. But in this, it is not fitting because I have to write he presented 1 year ago. Maybe he came to us only. So, or otherwise we can write his past medical history reveals that he had DSP 1 year ago and had major depression. That is where I'm using the first important. I have used many connectors, but this is one of the best connectors I'm telling you, for which he was attending Chinese speaking clinician sporadically. Sporadically, I don't know if you mention this word, it does not make a difference. If you do not mention this word, still it does not make a difference. So the main word I have written, his past medical history reveals that he had deliberate self-poisoning 1 year ago and had major depression. So I'm not changing this line. I'm keeping this line. So that is what was written exactly here, that his past medical history attended Chinese psychologist clinically and had 1 year ago with major. This is current presentation is second. Done. So I have written this thing. So his medical history reveals that he had DSP 1 year ago and had major depression for which he was attending Chinese Chinese psychologist. What was the word that was given? Chinese psychologist. That's it. So I will change my word, whatever. That is why OET is simple. Once you understand this thing, everything has been given to you. You just need to select and write. So now my second paragraph and my last paragraph is all set. That patient is basically from China. Now you can understand the context. Please have some patience, and after that, when I will read the whole letter, you will find it even easier. I'm just teaching you how to understand that how we should consider the data. That is why I have made it haphazard, but this is going to be very beneficial for you in the long term. Now the only thing that is left is this much data. That's it. That is the third paragraph. So, nursing management and progress. Frequently, SB, Chinese speaking transcultural mental health worker. I don't know what is that. Frequently, SB. So, now the second most important rule of OET, if you do not understand anything, don't take any risk. So, frequently, SB, Chinese speaking transcultural mental health worker and received one-to-one CBT counseling. So now the smartness is whenever, that is why OET is the easiest test, because you write only the thing you understand. So you write during hospitalization or during RK. So he was with us for 21 days. He was admitted on 5th and today was 26th, right? Let me check again so that I can tell you from where did I. 5th, he was admitted on 5th. Today is 26th. So I'm taking this data. So during hospitalization, that means during these 21 days, frequently Chinese speaking transcultural worker or frequently was meeting. But again, I don't want to take risk at the moment. My word count is already high. So main thing is received one to run. So during hospitalization, simple. Third paragraph. We'll always start with during hospitalization. The patient received 1-to-1 CBT counseling. Why am I writing this? Because this is something that needs to be continued. So again, I am selecting my data according to what I have written. Discharge plan is everything. That is why I'm teaching you so patiently so that you can understand what it is. That even this CBT I am writing is because CBT should be continued. We can continue only that thing which has already been given. So the counseling was given during hospitalization. CBT counseling. Insomnia and decreased mood. Metrazepine increased from 15 mg to 30 mg 12/4. So what was it on 12th of 4th? He was admitted on 5th April. So on 12th April, the medication was increased and he was having insomnia and decreased mood. So simple. Now you put full stop. Simple again. Please do not think anything complicated. Just write simple. The patient was having. If you are unable to understand anything, just write simple. The patient was having increased insomnia and decreased mood or decreased mood. Decreased mood is not a nice word, but we do not have, or a sad mood or a depressed mood, but decreased mood somehow I am not liking it. The patient was having increased insomnia and bad mood. So metrazepine was increased. Now this is very important. The passive voices. When you write the discharge plan, passive voice is in the form of should be plus third form. Please, very important to understand this grammar. When you do the discharge plan, he should be monitored. So you are telling the team leader that he should be monitored. That means in the future, when he comes to you, the patient should be monitored for this thing. But when you write during hospitalization, it should be in the past because you have already given these services. Like the patient was having this, so metrazepine was increased. This is a passive voice, was plus third form. Very important. Whenever anything would be done by the hospital, that is by us, for the patient, it is passive voice. So medication is always given by us from the hospital. So we say the medication was increased from 15 mg to 30 mg on 12th April, and this line will fetch you all the marks for grammars. So by this time, examiner would have already thought that he will give you 350 because you showed him the right grammar over here. Since then he has been depressed. Rest of the grammar should also be good, but these are special sentences where you can impress the examiner. And this is your passive voice, that mitrazepine, and spelling should not be wrong. Whatever is given over there should be taken that way. So mitrazepine was increased, so basically by us. The patient received, this is an active thing, patient received himself, so you never put was. That is the main grammar I want to teach. When the patient is receiving something, it is an active voice. The patient received this, the patient underwent surgery. But if anything is given by us, then we say mitrazepine was increased. Suppose if by chance you say, sir, CBT counseling was also given by us, then you have to change the whole sentence. During hospitalization, 1-to-1 CBT counseling was given. Now this is a passive voice and a correct passive voice. So you made it passive. You said CBT counseling was given by us. So now this is also correct. So this is what I wanted to teach when it comes to grammar. Patient received CBT. That's fine. CBT was given by us. That is a passive word. So during hospitalization, 1-to-1 CBT counseling was given. The patient was having this. So mitrazepine was a small connector was used over here as well. So the dose was increased. Now let's see any other important. Mother was educated via interpreter regarding the importance of antidepressant medication. This is very important. But again, the problem is they have not given me in the discharge plan. Otherwise, this data seems very important. So if I have any word count which is left, then I will use this data that mother was not in the favor of medication, so she was educated regarding the importance of antidepressant medication. Again, you can write it because it's a very important line. I don't want to miss it, so I will try to write it here. But normally these lines should also be given in the discharge plan, that her mother also was educated. But anyhow, so because in this, please understand, again try to understand that over here, that does not tell that community mental health team leader has to do anything with the mother. That is why it is not important. But just as a piece of information, you can write a small line that as her mother. So just a small line, just to give information, as her mother, his mother, sorry, as his mother has had Chinese beliefs, and everything will go in the past, had Chinese beliefs. So she was not in favor of antidepressants, but just 10 minutes more, everything would be clear to you. I know you are doing very patiently, especially the YouTube listeners will have more problem. But this is what, if you want to pass, this energy has to be spent. Even I do not like teaching that slow, but it's just about learning. So his mother was not in the favor of antidepressants. Okay. Depressant, I don't know what spelling depressants. I can take it from here. Why to take this antidepressants? Yeah, it's all good. So antidepressant should be together. So his mother was not in. So she was educated. I cannot use so again and again. His mother was having Chinese beliefs, and I made it simple. She was not favorable. So she was educated. Now again a passive voice, educated by us, educated regarding the importance of medications. That's it. I've written a small line. So that is where I am trying to control my word count by writing the things at important places. Yeah, done. So my word count is in control. I have mixed up a nice story. So that is what it needs. Now the last thing. Nil suicidation at present. Please monitor closely for SI in community, suicidal ideation in community. Okay. So now we'll make everything in the, now the patient is having nil suicidal, nil, suicidal ideation. So I'm writing only those words in the full forms which I know 100%. But he needs to be observed in the community. But he should be monitored closely in the community. If you will understand that this point I have covered over here, so I can take it from, but over here nothing was given. It was just benzodiazepines. So there was no, it's all good. So it is not repeating for the second time. It's all good. And mood low, but improved, low risk of self-harm with close follow-up and support, good response to CBT. So CBT counseling was given. Now the patient is better and he should be monitored closely in the community. That's it. It's all good. I don't have to write. So should be continued as well. Now I can add this point over here. It's my wish. It's my wish. I'm just trying to control the word count. So the only point I have left is mood low but improved, low risk of self-harm with close follow-up. I don't have to write anything because I have already written that he is having nil suicidal ideation. So that covers the point of low risk of self-harm. So points are merging. So I don't repeat things. Good response to CBT. I can add over here. CBT was given and he responded well. So let's make it simple over here. To it. That's it. Now, the most important thing is the first paragraph. Everything is covered. It's just the now I know everything about letter. That is, you don't have to write all these things like the way I did. Obviously, in the exam, by the time you will get trained, you will write the first paragraph first. But I wanted to teach you how to take it. Now, the purpose. Now, we all know the purpose. This letter, now it will become very simple because we know everything is being written regarding Mr. Mang. Just a second. It's almost done. Everything is done. Who was admitted due to deliberate self-poisoning and major depression. Now, after treatment, maybe after treatment and counseling, he is better. However, this is the main purpose line. This is the main line that you have made the patient better after treatment and counseling. However, he still needs monitoring and observation. So that was the main thing. He needs to be monitored for suicidal ideation, this and this. He needs monitoring and observation. Therefore, he is being referred to you. Or you can simply write he needs follow-up care. You can also write this word. So it is up to you. So the my letter is complete, all done. Total minutes I have consumed is 35, and in exam you will get 45 minutes. And obviously I'm teaching you, that's why I'm taking time. Otherwise you can well imagine OET letter can be done in only 25 to 30 minutes. And now if I read the letter in the flow, you would be able to understand what I have done. First paragraph, purpose. Purpose in brief. This letter is being written regarding this person who was admitted to our hospital, to our ward, to our mental health ward, or to our ward due to deliberate self-poisoning and major depression after treatment counseling. However, he needs, S is very important. He needs follow-up care, therefore he's being referred to you. That's it. Mr. Mang is, now I'm giving basic information in the second paragraph, social history and medical history. Mr. Mang is basically from China, speaks very less English, got divorced 1 year ago, has been depressed, and his past medical history reveals that he had deliberate self-poisoning paragraph as well. Why I'm writing as well? Because I have mentioned this time also he came. So as well means he came 1 year ago as well. He had deliberate self-poisoning and major depression. He had deliberate self-poisoning 1 year ago as well and had major depression too. for which he attending Chinese psychologists sporadically. Now this word is suiting well. So I'm writing exactly the same word. I'm not taking any risk. Whatever was given, using the same spelling, same words. That's it. Two paragraphs of over. During hospitalization, so because he came to us with depression and counsel this major depression. So one-to-one counseling was given, responded well to it. The patient was having insomnia and benzodiazepine was increased as his mother had Chinese beliefs, so she was educated. Now the patient is having nil suicidal ideation, and he should be monitored closely. It would be greatly appreciated if you could assign the patient to this. Further, the patient should be observed for this, and the patient needs to be encouraged for this. It is important to be noted that this could be used for this. Along with this, CB should continue as well as he is responding well to it, well to this therapy. That's it. Thoda, that is I have done to make it just better. That goes in a flow that he has responded. Now now this is over. The letter, the body of the letter is over. Now the only thing we are worried about is how to write other things which are kind of does not are not counted in the word count. So should you require further information, just you are listening to this video for 2-3 times and you would become the best in OET writing. Should you require further information, feel free to contact. That's it. Over. And last, you are sincerely, if you know the name of the nurse, again, I have always told you, listen to my videos till end because some important information comes in the lab. If the name of the nurse is given, let's see, name of the nurse is given to whom we are writing the letter. Now, name of the nurse is not given, so you will write yours sincerely. Otherwise, you will write, sorry, if the name is not given, you will write faithfully. Or otherwise, if the name is given, you will write sincerely. If the name is not given, you will write yours faithfully. Yeah. So I'm writing your faithfully rather than sincerely. Your faithfully registered nurse. Where were you registered nurse? Let's see. You were registered nurse. Where? Mental health ward. Which hospital? Macquarie Hospital, Rosilla ward. Mental health ward. Small things. Mental health ward. Hospital name. Macquarie Hospital. Spelling Macquarie. Yeah. That's it. Rosilla ward. Rosilla word I can use. Word I should not write. But anyhow, it has been given, so can't really help it. Yeah. That's it. And now the top thing is left. That is what to write in the start. So in the start, first of all, you will write the person to whom you are writing the letter. So whom am I writing the letter? Because you are addressing to the person to whom you are writing the letter. So please listen to this video 2-3 times who are new to OET. It will not take much time, but you will learn a lot of things. Team leader, write community mental health team. A team leader. No commas, nothing. Team leader. No commas, nothing. Mental health. Was this? Right community mental health team. Right community mental health team. So you are writing to the team leader of this team. Then the second thing you will write is date. What's the date today? When date of discharge is the date of today. So what's the date of today? 26th of April. All right, 26 April, no TH. There is no use of TH. April, 2009. That's it. 2011, sorry. Yeah, there you go. Then you write regarding the name of the patient. The name of the patient is Mr. Ming Zhang, age 24. That is how you should write Mr. Ming, sorry, Ming, M capital, rest of the word smaller. Ming, no full stop, no commas over here, Mr. ke baad. Mr. Ming Zhang, that's it. Aged 24, that's it. Done. And then you say, dear Sir, madam, sorry, slash. Sir, madam, comma. So that is the pattern of OET letter. If the name would have been given over here, suppose the name is Mrs. Brown. So you will do Mrs. Brown, team leader, this and this. Over here it will come, dear Mrs. Brown. That is the only change you will do. And over here you will make it yours sincerely if the name is given. So that is the difference. So yeah, that's pretty much. This is the small OET letter that can make your life and can change your life. And this is Dr. Bhupesh from Dr. BKM Institutes. I hope you loved the video. And Minu ma'am, you are sleeping very well. I have recorded this video. This is like, I don't know what to say, but yeah, please follow the channel. And thank you very much. And please, if you have any queries, leave in the comment box. Thank you.